Hey, Margie here. Today we're taking the test, do not guess concept to a deeper level. Because as I talked about on this podcast, it's so important to figure out the root cause of whether it's our bone loss or whatever chronic condition we may have, or whatever we're dealing with. And so to do that, I wanted to let people know about something else that existed, functional diagnostic nutrition. And this is a training that people have in ordering lab tests and really trying to get to the root cause. And so to do that, today I'm interviewing Reed Davis. And Reed is board certified holistic health practitioner and certified nutritional therapist. He's an expert in functional lab testing and holistic lifestyle medicine. And Reed is the founder of Functional Diagnostic Nutrition, also called FDN, and the FDN Certification Course, with over 3,000 graduates in 50 countries. Reed has also served as a health director at a wellness center in Southern California for over a decade. And I wanted to expose everybody to FDN so that you know that this is also a possible way of looking at root causes and getting to the bottom of what may be your underlying issues. So lots of great information. So stay tuned. Welcome, Reed. I'm really thrilled to have you here on the podcast.
Thanks so much, Margie. It's a real pleasure to be here. Hope we do some good today.
You know, I always love to hear the backstory, how you got to do what you do today, which is really influence and teach so many people who make a big difference in the world. So you're one of those people that are really impacting so many, but you didn't start out that way. So why don't you tell me how you got to do what it is that you are doing today?
Yeah, thank you. I didn't think I'd end up being a teacher. I was actually saving the planet. I was an environmental law paralegal out there, saving the birds, trees, bees, and so on. And I, in the late 90s, turned my attention to people. Well, what's this environment? I see all this damage. What's it doing to people, including me? Because I was very healthy, but I didn't want anything sneaking up on me. So I changed jobs. I went to work in a clinic in Southern California, and I worked my way up to the health director and case manager of the clinic. I worked very, very hard. One of the first things I noticed going in, again, I hadn't really been to a doctor except dental and maybe for some injuries from sports and things. So everyone coming in the door they were seeking alternative health solutions for chronic long-term conditions that were generally downward spiraling. Things like osteoporosis, for instance, which I know is going to come up, and people weren't getting help. They were not getting the help they needed. I identified immediately a cycle of trial and error. Some people are going to their physicians being told nothing's wrong with you. Your blood work looks normal. You probably heard that one before, right?
Yeah, all the time.
And yet they knew something was wrong. Other people were being diagnosed and treated, and it just wasn't getting the job done. You know, the minute you lay down a diagnosis, you're leaving all the other things they need to do off the table. You start narrowing it down. So, I wasn't a physician and I couldn't treat anything specifically. So I found a way to really treat the whole person, the whole body, every cell, tissue, organ, and system simultaneously. Now, it took me 10 years of running thousands and thousands of lab tests on the patients coming in. They were my clients, but they were coming in for some kind of doctor visit, chiropractic, acupuncture. We had other modalities. And so I just identified that cycle of trial and error, ran thousands of labs, started recognizing some patterns. I had good mentorship, but when you run that many labs, you learn a few things. And I'm a good organizer. So I was able to organize this system of looking into what's really wrong, sometimes way upstream from where the symptoms were, including bone density. You have to take that way upstream approach to it. And then, again, not being able to write a prescription was actually a good thing. It's like, well, what can the person do? And that became the ultimate goal, was to put the control over one's health in one's own hands. Why would you give it up to someone else when you can learn and take control of that health yourself? So that's how I got started. I did that for 10 years. And at some point, the system was working so well, and I was doing a lot of business, and I was asked to start teaching by consumers and the people I do business with. They're asking, "Who the hell are you? You know, nobody runs this many labs. You run more labs than a doctor with 5 doctors in the office. How are you doing that?" "I don't know. I just do it. You know, I like it." And they said, "You need to be teaching others." So in 2008, did my first class. People loved it, and we've expanded on it since then. We now have a complete and full certification course in what we do.
And how many people now are in this program?
I've trained over 3,000 people. Currently probably have 250 students. But more importantly, I have an alumni of over 500 dues paying graduates. Like they become part of this community, and we are very highly engaged and all working together, lots of peer support, but lots of support from the executive director I hired to run the post-grad alumni association. So it's, of course, we're helping tens of thousands of people around the world.
I love that, because as a health coach myself, so often you need that camaraderie. There's so many diagnoses that you don't know what's going on. So to have the support of a community is just really fantastic. So that's really a wonderful piece of your program. So let's get started on talking about testing, because you are, as you said, probably done more tests than almost anybody. So you have so much wisdom and knowledge to bring to the table about this. But I would love to know what your D.R.E.S. for Health Success protocol is. You have a certain protocol that you use when you're treating?
Oh, sure. Yeah, again, there's 2 main steps to our protocol. There's the running the labs. Like we aren't going to guess, we're going to test. And we aren't going to guess about which test. We're going to run a number of tests. We're going to look at the hormones, the immune system, digestion, detoxification, a couple other areas. So you have to do the great assessment first. But then the key to the lifestyle holistic grounding program is one's own behavior. And so it just occurred to me one day that we were doing diet and rest and exercise and stress reduction and supplementation, and that spells D.R.E.S s, D.R.E.S.S. So it just came out that way, and it's very easy to remember. So it covers everything you need to do. Keep in mind, you don't just want a prescription, or even as I was trained initially, Margie, it was, well, here's the supplements that would replace the drugs and be more safer. That's good, but it still isn't enough. If you don't eat right and go to bed and get good sleep and rest other times of the day, rest your spirit, your emotions, if you will. You can do that anytime. So diet, rest, and exercise. Sitting is the new smoking. You can't be healthy if you don't move around. And there's different programs for different people. Diet, rest, exercise. Stress reduction is a biggie because it's so ubiquitous. There's so many different types of stressors. I started off studying the environmental stressors, the influences of chemicals and whatever, air, water, again, all these things that are out there. But there's so many other types of stress: mental, emotional, spiritual angst, physical trauma, and then obviously the biochemical stressors from personal care products and household cleaning products and what's in your furniture and paint and you name it. So there's all these types of stress. So diet, rest, exercise, stress reduction, which is huge. We sort all that out, and then supplements are more effective, and you can pick and choose those based on the lab work too. Finally, they're meant to support, stimulate, substitute for what's missing in food, and even for self-treatment sometimes.
Yeah, I love that. I'm a big fan of D.R.E.S. for Success. So I love D.R.E.S. for Health Success. That's
I copied that old book back in the day, in the I think 70s is when that book came out.
Yeah, and then there's a charity, Dress for Success, where people donate clothing, actually.
Oh, no kidding.
Yeah, they donate
Yeah.
clothing that, for people who are looking for jobs, who can't afford business, and then they really learn how to interview. It's a wonderful program. So
It's really
anyway,
funny. This is a
yeah.
side note, but in that book, Dress for Success, it came out in the 70s. If you go back and look at it now, it's got, bell-bottom pants and long hair
Yeah.
and big white ties,
Yeah, I'm sure a lot of people listening don't even know that
they don't.
existed.
Yeah. Okay. Well, hopefully some do. Guess I'm dating myself.
Oh no, I was around with that book as well. So let's since you've seen so many lab tests and you've been doing this for a long time as well as teaching it, let's talk about the person that finds out they have osteoporosis, osteopenia. What lab tests do you think are most important and why? We can sort of go through these systematically.
Yeah, well, the first test, usually it needs to be a DEXA scan to find out what is your bone density. And I've spoken a lot about this and written a manual and done quite a bit of presentations and lectures on it. There are tests that you could do right now. The CTX and the NTX testing. These are urine or blood, where you can see the rate at which you're excreting certain proteins that give you, some guidance on how fast are you losing bone density. The biggest cause of an acceleration in loss of bone density is menopause for women, and just aging. But the real problem, I'm afraid, is not even being addressed, and that's low bone density when you were younger and not doing the things when you're younger, or having the genetics that would lead to a high bone density at around 30 years old. So typically the bone density curve goes like this. Your bones get denser and denser and denser until you're about 30. And then it should maintain itself for some time if you're healthy and doing all the right things, but it is going to go down. You will lose some. So if you had very high bone density at 30, you probably never have a worry or care. And I remember, I've done over 10,000 bone density tests myself. I had my own DEXA machine back in the early part of the century for years. For 5 years, I was out in the public doing this. It's how I built my business, actually testing bone density and then helping figure out why it's low, or better, how can you increase it? And I could tell you story after story. We had a lot of success in helping people reestablish a curve, a more natural curve. And age did have a lot to do with it. And so it teaches people, look, it isn't that you lost a lot of bone. You never had good bone density. You peaked low to where you're obviously going to be, at least in osteopenia, which is thinning bone, even when you're 60. And if you're hitting menopause early, it used to be 51 years old. Now I think it's 45 or something like that. You're losing the hormones that help recycle bone or regenerate bone. Your estrogen and progesterone ratio is really, really critical. So that's another thing we test, to answer your question. I just have so much to say about it. I'll get going here. But the testing, you want a DEXA that tells you your current status. What is your bone density? They will usually do the neck, the low spine, and the hips. And because hips are very susceptible to breaking if you don't have good bone density, right? It's called the greater trochanter, right where it goes into the socket of the pelvis. You get a lot of breaks right there, and it's just because your upper body weight, you no longer can maintain the stability at that area, and it'll just break. So you can get those areas tested, and if it's low, you can adopt certain habits, and the D.R.E.S.S program, the right diet and rest and exercise, is critical. Reducing stress is critical, and supplements are critical. And stress, by the way, it raises your cortisol. Well, cortisol directly suppresses bone formation. It suppresses the progesterone and the osteoclasts, which are responsible for, the osteoblasts, which are responsible for building bone. The osteoclast, as you know, is regulated by estrogen. So with high estrogen, the osteoclasts are suppressed. They go slowly with high estrogen. Highest normal levels will keep the osteoblast from eating too much bone. Now, when you go into menopause, this is why you want to get your hormones tested. You're going to lose that estrogen. You no longer have the protection on the bones. The osteoclasts go faster, eat more bone. And with low progesterone, you're not building as much. And with stress, which we also measure that cortisol, is further suppressing osteoblastic activity, or the building and reformation of bone. So I always test the hormones.
At what age? At what age when someone?
Well, that's another really fascinating question. When I was doing the bone density testing, and I work in Southern California, we had a lot of non-English speaking people, and it would be the daughter that brought the mother in at 60, and let's say the daughter's 30. And if the 60-year-old had very low bone density, and I started explaining, look, it isn't that you lost a lot. We're not all given the same amount, and some lose at a real high rate. That's not what's going on. Your mother never had good bones. So guess who else should get tested? The 30-year-old. Now, I was offering a very inexpensive, very accurate, but inexpensive test. So it was very easy to test younger people. If your bone density peaks at 30, wouldn't you want to know what it is at its peak? So that if it's low, you can start forming the habits and doing the things that would even build it up. And it can be built up. I've had both older men and older women, tested them low, get them on the right D.R.E.S.S program, especially, I hate to admit a reliance on supplementation, but especially that, and build the bones, right, start to see the curve reverse. They're no longer losing it. So at least maintaining it and even building it up. And I've seen the scores. I maybe some future time will share my screen with you and show you some changes in bone density, and you'd be really surprised.
No, I totally agree, because I've seen the same thing. I've been doing this for over 25 years. And you're right. When people, and it's interesting because, a lot of times people aren't tested till 65. If they don't have any risk factors, they're not tested till 65. That's the standard. But yet it's so good to know early on, so you have a baseline. But I've seen the same thing, that when you do incorporate all these different pieces and really figure out what's causing bone loss, it can make such a big difference. And you're so right. I just think one of my goals is to just get people at all ages, young people doing jumping, doing the activities, eating the right food, and starting these habits, because I think it could eradicate osteoporosis if we, really, because right now it's a disaster. What, people are sedentary, they're not getting the exercise, they're not getting nutrition. So I couldn't agree with you more. So in terms of the hormone testing, then, is there anything specific you want to say that you see typically that's so important?
Sure. Well, when you're testing from a naturopathic standpoint, like, we're not looking to diagnose and treat one thing. We're looking for healing opportunities. Like, where can you make improvements? And where can you make improvements where improved lifestyle will be the point from which you make those improvements. So we say test, don't guess. Let's look at the data. And I would start with a person who, just speaking about this one group of people who have a concern. If you're 30 and your mom has osteoporosis, get tested. Look at your current bone density. Pay for the test. The scans aren't that expensive. Very few people have the machine that I had 20 years ago that was very inexpensive, but hopefully they're around. And you want to get checked out at 30, 35, when you still have plenty of time to do something about it. And it hasn't gone down into osteoporosis yet. You catch it when it's early osteopenia, say just below the line. That would be a T-score of -1. And so if your T-score is between 0 and -1, you're on the low side. And after -1, you're osteopenic, and after -2.5, you are osteoporotic. And so you can find out exactly where you are. And these tests are very accurate. They measure to within a tiny, tiny little fraction of the minerals per square centimeter. So actually how dense you are. I tested mine year after year after year when I was doing that. And turns out I'm very dense. So that was my little joke. See, now, yeah. So very good, solid bones. Never broken a bone. Just solid as could be. Matter of fact, they make you heavier. People with really strong bones are heavier for their size and shape than others. A few extra pounds of bone density. It's amazing. And so, we would test you to see where you're at. We want to keep your hormones in balance because, again, that progesterone estrogen balance, that's so good for life anyway. If you want to be youthful, you want good youthful levels of those things, the same levels if you can, while you were, if you're postmenopause, as even before you went into menopause, like nice juicy levels of these hormones. And you also want to test the stress hormones, cortisol being the main one. We do a cortisol and DHEA comparison, and really educate people on whether they're too high, too low. They may have hidden stressors they don't even know about. Again, this cortisol suppresses bone formation. And so now another one.
Can I just ask you a question? What
Yeah.
have you seen with the testing of the DHEA and the cortisol after doing, so many in your career?
You see high cortisol and low DHEA. DHEA is the parent of testosterone and estrogen, which are really important. Testosterone plays a factor too, especially in men, but it's important. So we look at the cortisol to DHEA, high cortisol, low DHEA, and you're in trouble. You're in an anabolic state. Matter of fact, a catabolic state. And you need to have balance between catabolism and anabolic, catabolic. They need to be in balance. So cortisol, DHEA measurements can give us that. And I don't want to get too technical, but we could look at that and be very accurate, give an assessment, and then give you things to do. And it's a lot of just reducing stress.
That's a really exciting thing. And I find people don't really put the effort or the attention on how serious stress is and how much it can affect your overall health and your bones as well, because usually people just want to know what exercises to do, what food to eat, what supplements, and they don't realize that the stress is such a huge piece. So that's very interesting with all your testing that you find, the high cortisol is a significant problem.
Yes. And even if cortisol is kind of normal, it could be that you just can't produce that. You can only take so much stress and your body starts to break down. So high cortisol to DHEA ratio won't just break down your bones. It breaks down your muscles and everything starts to deteriorate. And it doesn't have to be real high cortisol. It has to be high in relationship to its counteractive hormone, DHEA. So you could have ordinary cortisol, but if your DHEA is also gone way down, you're still out of balance. And that's what happens to people is they're not making real high cortisol anymore. They can't, but it's still high in relationship to DHEA. All right, so enough on that. The other test that we do a lot of is digestion. Because people, obviously diet is critical. You just mentioned it along with exercise. It's not enough, but it's a really important aspect. And it's not always, what you're eating that's critical. But what about how well are you digesting and absorbing it? Do you have really good digestion? Are you really getting all the vitamins and minerals and essential fatty acids, amino acids, all the trace elements, all the antioxidants? Are you getting all that from food? So really, really good digestion, which is easy to test, is another marker we use. And other things come into play there. What's the do you have a dysbiosis? What's the microbiome status in the gut so that you're getting all of this great breakdown of food and you're protecting yourself immunologically? 70% of your immune system at least is in the gut, where all this digestion and assimilation is taking place. Further breakdown there can end up congesting your liver. It just goes on and on. And so we have a path that we follow. We check the hormones. We do check that immune system and digestion. Also detoxification, liver and your detoxing organs. Are they working well? Because to be healthy, whether it's good bones or just good brain function, you have to have all these things in place. We also look at energy production, make sure you're eating right and that you're producing energy on a cellular level. I'll ask you a question in the audience. Do you think you have to teach any of your cells what their job is? No. They have an innate wisdom and intelligence. They know what their job is. You just have to feed them and nurture and detoxify and do all these things right. So what we've done is try to make it simple. So on top of that, the hormones, the immune system, digestion, detoxification, energy production is nervous system balance. If you're in a sympathetic dominant state all the time, that's kind of the anxiety state. It's called fight flight. Your cortisol will be driven. It will be higher, and it's not good for your health. Again, whether it's the brain or bones, not good for you. And so that, by the way, that investigation spells hidden, HIDDEN, hormone, immune, digestion, detoxification, energy production, and nervous system balance. So the hidden investigation, it's very systematic. It's a great way of looking at any health condition, whether it's the bones or, again, the brain or, energy. And people have skin conditions and hair thinning and all these things going on. Some people would say it's just aging. And we would say, well, what about anti-aging? What about just trying to stay youthful? So hidden investigation is the system I developed in 10 years in the office. And then the D.R.E.S.S program is the answer. So investigation into the healing opportunities, what's really going on. And then we don't want to treat one thing or just write a prescription to make the numbers on the paper go up and down. We want to give you things to do where they, as a consequence of better behavior, go back into what would be considered an optimum range, some of these test numbers. So it's as simple as that. Obviously, it could take working with a professional and getting some help to understand all this. That's why I created my certification course.
Yes. So a couple of things before we get into that, because I think it's important for people to know, who can they look for that has, that it's gone through this. But, I think it's interesting because a lot of times people, you're testing not based on symptoms. You're testing, you have a deeper way that you test. And can you explain why when you just
Sure.
what you miss? Because a lot of times people will just, oh, that's my symptom. And they're only testing for that.
Yeah, really good question. There's other, you might say, well, I've already been tested. I ran some tests and I'm still in the cycle of trial and error. Well, our job, what I decided over 20 years ago is I'm going to break that cycle for people, help them to break the cycle, to end it. And so that's why you need a system to follow. So you're not just picking and choosing based on your symptoms. Back to your question. If you go to a practitioner and you say, I'm tired, I'm fatigued, I'm overweight, I can't seem to lose this 10 or 15 pounds. My hair's thinning. I've got a cold or even numb extremities. I'm constipated. That sounds like thyroid to any good clinician. It's a traditionally reliable cluster of symptoms that points the finger at thyroid. And so the average clinician would test the thyroid and then pat themselves on the back, say, I found your problem. It's low thyroid. And then prescribe something that would change the numbers on the paper. And you might even feel a little bit better. But if you don't look further upstream for why is my thyroid underactive, you're going to miss the boat. And those symptoms are either going to come back, sometimes with a vengeance, or they will appear as new symptoms. And the same sort of, guess, what are those symptoms? Oh, low libido, can't build any muscle, like low energy again, oh, that sounds like low testosterone. Let's test your testosterone. Yep, pat myself in the back, found your problem. And here's your prescription again to change the numbers on the paper. So what we do is we leave that type of practice to those licensed to do it, the diagnosis and treatment of specific, and we start way upstream. When I mention HIDDEN, that's just 5 labs and a couple of quizzes. And then we have this whole entire constellation of healing opportunities, regardless of what's going on downstream. Some of these healing opportunities are quite far removed from where you think the symptoms are coming from, like thyroid symptoms. Or how about this one? It sounds like a parasite. God forbid you find a parasite and pat yourself on the back, because there's a reason the person was susceptible to parasites. It's typically a breakdown, stress, maldigestion, malabsorption, dysbiosis. Bigger bugs move in like the parasites, and then you get real symptomatic. So if you just say it sounds, if you're only treating the test most closely associated with those symptoms, you're going to miss the other entire healing constellation. And so we're very disciplined. And this is something, again, that I started working on 22 years ago, and it works. We will outperform that other system. It's why we're popular and gaining notoriety.
So the 5 tests, are they things that people can they send away for it? How does it work in terms of the logistics?
But we have basically this a form of self-testing, direct to consumer kind of thing, but it's guided by one of my practitioners. So we can make sure you get the right saliva test, urine test, blood test, stool test, whatever it might be. And so we're going to look again at HIDDEN, and then assess it, do an analysis. It's not a medical interpretation of those labs. Doctors look for they use a little bit of the data, come up with a diagnosis that they can then treat. And there's a standard of care there that they're handcuffed to, especially when it's connected with insurance, who pretty much dictates what labs they can run and what the protocol better be. We call it the DX/TX, diagnosis treatment. There's algorithms that they're bound to follow. They can't go outside of it. So we don't have the same boundaries. We can say to you, how about these labs? So we get this whole entire picture, and then what to do about it. How can, the lab results aren't the problem. They're the result of the problem. Which is all this dysfunction upstream, things out of balance. And those things, by the way, are crashing into each other. And there's no way to directly measure some of it, not singly measure some of these interactions between upstream causal factors. Again, the environment combined with, your lifestyle, and you bring these other factors in, the hormones, and all these things that I mentioned. So it's as holistic as you can get.
And are there anything that you wanted to shed light upon for this community who's interested in bone health? Is there anything that you've seen that, I know for me personally, I see so many people who have issues with gluten. It's shocking to me in terms of the people that I see. Is there anything that, with all these years, that you've been surprised that you've seen, with people who have lost bone?
Yeah, I don't know if much surprises me anymore, but as I was learning, it was quite fascinating how it's never one thing. There are multiple causes in every condition. There's multiple factors to be considered. And the moment you go to a physician and he or she lays down a diagnosis, that's just how they work. And that diagnosis and the treatment of it probably is going to become the main topic over your next several visits, however long that is. They likely are going to leave a lot off the table. They're not going to be talking about diet and rest and exercise and stress reduction and supplementation, the true, the ways that you can be in control. They may control by diagnosing and treating specifics, getting on medication, maybe monitoring the levels thereafter and titrating accordingly. But your complaints tend to fall to the wayside. It just becomes about what they say you have. And so a holistic approach doesn't work that way. Again, our intakes are based on your complaints, and we're not going to turn it into a conversation about just the standard of care. Well, it's your hypothyroidism, and it's just a different way of doing business. So I would say that if you want control over your health, hook up with someone who that's their MO, that's their modus operandi, that's how they think and how they go about their business of helping people. You have to look at multiple causal factors and deal with them all at one time through a holistic lifestyle program.
Well, the good news about that is when you do that, everything gets better. It's not just that maybe your bones, get healthier, but all sorts of things clear up that you didn't even probably realize were a problem. That's what I've seen. And that's what's, to me, that's the silver lining when you do take this type of approach, is that, people feel better than they've ever expected.
Yeah, no question about it. People go through 3 phases generally. One is relief. That's what you usually go to a doctor for, a practitioner for, is relief. I feel lousy, whatever that means to you, your main complaint. And you should feel better very soon. Pretty much you lived yourself into that situation. You can reverse it and live yourself back out of it. Again, your habits got you there. Your habits can get you out of there, and you'll feel better soon. But a lot of these things have been going on for a long time. They actually have broken your body down. They've created weaknesses, weak links in metabolism, and lots of different things. So that's the corrective phase. So you should feel better, more energy, better libido, clearer thinking, lose a few pounds. All those things happen very quickly. But the long-term stuff takes time. We call that the corrective phase. And that's where health coaching comes in really critical. It keeps you on track because you feel better. And if you feel better in 3 weeks, you might just go back to the way you were, and then you're going to feel crappy again. So you want to feel better, yes, but you also want to maintain. See how good it can get. See how good you can get your immune system. And then, of course, there's maintenance. So relief, corrective, and maintenance types of care, if you want, or the things you get to do on your own would be there. And you would only come back if you have a lapse. Like I've had clients say, I fell off the wagon again. I want to run the tests again and go through the whole process over. Well, we don't recommend that, but we're there for those people too.
So tell everybody do you have a list of practitioners? How do they find someone who's had this functional diagnostic nutrition training? And we can put it in the show notes as well. Yeah.
Yeah, I think that should go in your show notes. Yeah. I think what you want to do is go to functionaldiagnosticnutrition.com/happy. So it's a long name, functional diagnostic nutrition.com. I couldn't think of a longer name. So, but it's /happy, named after your show.
Oh,
Margie. So functionaldiagnosticnutrition.com/happy. And you'll get more information and find out where you can, get a practitioner who's trained by me. Or for some people, it might be interested in getting some training. I've had a lot of people go through our course just to get healthy themselves.
Yeah, isn't that interesting?
Just want to really learn. That alone is worth the price of admission, I assure you.
Well, what I find interesting is so many practitioners, that's how they start. They have their own condition and they're just fed up with the system, can't figure it out. And then when something works, it's your natural tendency. You want to help all those other people who are suffering like you are. And I think that's what's so beautiful about when you do these tests that aren't the mainstream. It's not the first thing when you find out on a DEXA you've lost bone, well, let's really dig deep and let's really see what could be some of the, what else is going on, as you say. And I love all your acronyms. Those are great.
They make it easy to remember the
Yeah,
acronyms.
yeah, exactly. Yeah.
What you said is really critical. I interviewed the first 2,000 graduates of my program. Largely, I was looking for, how can I make it better? I just wanted to find out, what was your experience? What else would you like to see in a course like this? That's how we developed the postgrad program, which is tremendous amount of support for the new practitioner. But the course itself has grown. It's very robust. It's a course in all the anatomy and physiology and biochemistry of the labs and how people work. How do you work on the inside? The HIDDEN areas. And then the protocols. How do you figure out the right diet for a person and all these other programs? And then it's about the business and onboarding and things like that. But people go through it. And I interviewed all these early graduates and they told me how to make the course better. But they also told me how they found the program in the first place. Like, how did you find FDN? We call it FDN. I had my own I was Hashimoto's, or I had bone density problems, or I had, you name it. And I was searching for an answer, the right answer. And there was nowhere. Everywhere I went, I got a song and a dance, or try this or try that. And so your program was the first one that said, hey, let's really look into these areas and figure out what's really wrong. You're the first program they ever saw that offered that. So they joined for that reason. And in the course of going through the program, it's a 6 to 10 month program. They got better. Their whole life changed around. And so very excited. And now, as they enter health entrepreneurship, starting their own home-based businesses, they tend to specialize in the problem that they had. So I'm just backing you up and saying that it's amazing how that works. And you tend to attract attracts like. So, you got over your own bone density or Hashimoto's or whatever, chronic fatigue, fibromyalgia, irritable bowel, you name it. And then you end up being able to help others do the same thing and make a good living doing it. It's quite remarkable.
Well, that to me is so great, because I also teach happiness, and you have to be passionate about what you're doing in the world. And when you can do something that you've helped yourself and then help others, there's just nothing better, for those people that feel that they have that desire. So I think it's really a wonderful program that you've created and that you're, spreading to really help people get to the root causes and really, so that we can feel better ourselves, but also, then take it to the next level for those who want to help others. So
right back at you, Margie, because happiness is a key. It starts off, if you ask me, what's your number one tip, I'd say attitude. Just you get up in the morning, is the cup half full or is the cup half empty? Those that wake up and say the cup's half full, it's going to be a good day, I've got a lot to be thankful for, and you just try to make it better every day, they're much happier people. And it's a big part of, in our stress reduction, we kind of cover that.
Yeah, no, that's great. Well, this has been really wonderful. And I really wanted to share this because I want people to know what's possible, what exists out there. I don't think a lot of people know about this training, even though I have had practitioners come on the podcast and talk about it. But I really you're the person that created this. So I'm so grateful for you for being here and sharing your wisdom, as well as, just doing this and making such a big difference in the world. Is there any last minute things you want to share before we end?
Well, I was thinking that there's one more website that I could give you for people. It's FDN Thrive, FDN Thrive, THRIVE.com. And it is a place where people could go just to take a look at some opportunities. Between now and when this airs, I think we'll call it FDNThrive.com/happy.
Okay.
I'll make that up. Yeah. So let's just people go there. Everything will be good.
And I'll put those all in the show notes. Oh, great.
Okay. Yeah. Thank you.
Okay. Well, thank you, Reed, so much. And thank you for what you've done. I love when people have just made such a big impact, and it's the ripple effect. You started training one person who's now working with hundreds of people, and it should feel so good. So thank you for sharing all this with all
Thank
of
you.
us today. And I look forward
Thanks.
to
Thanks for
staying in
having me.
touch.
Anytime.
I hope you enjoyed my interview with Reed and now have a better understanding of why it's so important that we dig deep and we look at all the root causes of either our bone health or whatever condition we may be dealing with, because that's really where we're going to make a big difference. All the links that Reed talked about will be in the show notes, including the link to find an FDN practitioner, as well as if it's something that you're interested in exploring. So thanks so much for tuning in, and I look forward to seeing you on the next episode.